If you're suffering from addiction and need help getting your life back on track, then talking to the people at Mount Regis may just be the answer that you're looking for. Shane Fletcher walks us through their new young adult track.
Specialty tracks identify the specific needs of the patient. We're going to roll out 3 specialty tracks: relapse prevention, trauma and abuse, and young adults, 18 to 25-year-olds.
And I feel like that really does touch on a lot of different types of people, and especially, relapse prevention. You don't want to send somebody out of here and then have them come back right away. You want to give them that support when they leave, but you're actually working on the young adults track, right?
Correct, that is correct.
And what does that track entail?
That's going to be a lot of teaching life skills that patients have lost because of addictions or have never learned, depending on their background, their home environment. So, we'll be focused on life skills, resume building, financial management, a little bit of trauma and abuse. However, most of those patients will go into that specialty track.
And how does somebody get put on one of those tracks?
The counselors, when we're doing their assessments, will identify what the major issues are with that patient according to what they tell us in their feedback, and then we'll assign them to particular tracks.
Gotcha. And how did you come up with the issues that each track addresses?
The trauma track and the relapse prevention track are tracks that we had already had.
Okay.
They'll be expanded and more focused on. The 18 to 25-year-old track has been a track that's been largely neglected in this area, but there's specific needs to that age population in addition to the addiction and substance abuse.
And why is that age group such maybe a tough age to treat?
A large portion of our patients that come in fall into that age group and have issues with opiates, heroin addiction. Those are large addictions for that, and that creates a set of issues in itself with just life skills in general, a lot of self-esteem issues, which could be produced through neglect and trauma issues as a child.
This is a good place to come and get help if you're, struggling with an addiction, obviously. But it's also nice to know that there's a track in place to kind of walk you through those skills and reteach you or teach you for the first time how to do simple things in some cases.
Correct. Yeah, a lot of folks are almost live a transient lifestyle prior to coming here and gaining sobriety. And we want to reteach them things that hopefully they should have learned growing up, but some folks just haven't.
And sometimes it's just about putting that structure back into place so that they have an organized life to go back to when they leave here, and they're not just, like you said, transient and kind of, up to bad things when they leave.
Right. The mentality as well of a lot of young adults, especially with addictions, is kind of, it's set back to a lot of times whatever age they started using. Mm-hmm. So if somebody starts abusing opiates at 16 years old, they're going to act like a 16-year-old.
Gotcha.
And not have developed to the appropriate age that they're at chronologically.
What made you personally want to set up this track for 18 and 25-year-olds and work with them?
My history is working with a lot of young adults in institutional training environments. So I had a pretty good understanding of that age group, and having children that age as well has given me a pretty good understanding of that age group and some of the issues that they face.
And how long is this track?
It could potentially go to 60 days, maybe be expanded to 90 days, but a lot of it will be dependent upon the needs of the population at the time.
And so we've talked before, the hardest step a lot of times is just walking in the doors here, but once somebody does come in, you guys are here to help.
We are. We absolutely are. We hopefully we provide an environment that makes the patient feel that they're the only patient that we have. So a lot of the feedback that I hear, and I see it all the time, the patients really like this place because they do feel cared about and that it's not an institutional setting.
And the people at Mount Regis Center really are there to help. They're located on Kimball Avenue in Salem. For more information, you can give them a call at 540-389-4761, and you can go online to mountregis.com.